Hi, everyone. It's great to have you here. I'm Teresa Youngkin, and I'm passionate about helping healthcare executives stay ahead of the curve when it comes to new technologies by simplifying IT concepts into business oriented language. So, whether you're struggling with data initiatives, trying to make informed decisions about new technologies, or dealing with constant changes in our market because they're always here, got you covered. So, as an experienced health informaticist, I'm excited to dive into the importance of interoperability in telehealth. This is a real world story, and just letting you know, it's my personal story. So, this week has been a very, very different week for me, and it marks two significant events in my life and my journey in healthcare. The first event, well, many of you don't know that my journey in healthcare started when my otherwise healthy 31-year-old husband, David, was diagnosed with terminal brain cancer in 2001. It was through that experience I learned how to interact and to deal with the very confusing, not so friendly patient environment that we call healthcare. During that time, we were fortunate to experience what is now called telehealth. And the doctor was coordinating his care. He was in North Carolina. And during that time, we'd moved from Oregon to Pennsylvania to be near our family and our support systems, which are terribly important, as you all know. And because David's providers were connected through the Vista, which is the VA's electronic health system, we would be able to get tests and medications at the VA, and all his outside doctors could get the same information that was needed to help David live longer than most patients with this diagnosis. Those extra 3 years are a blessing that no one could ever know to our family. And things weren't not always perfect, and there are many challenges, but we knew that the test results and the treatment plans were being discussed and they were being shared among David's many providers. What I didn't know until so many years later was that the VA shared their records with outside treatment teams using fax machines, and that really did lessen the burden on us. We were just experiencing it. David and I, the patient and the caregiver, it allowed us to concentrate on more important things like creating memories with our three kids. And after 5 long years of coordinating appointments, filling out what felt like 1,000 forms, and carrying every single film and slice of my husband's MRIs between providers and working with different doctors and specialists, David did lose his fight with cancer. And June 6th marked 17 years since we lost David. And I have to tell you that it doesn't matter how long ago it happens, when that day comes around, it's the little things that creep into your memory, and that's probably, like, why my life is about that today. Well, since that time, I've gotten married to a great guy who also works in healthcare, and Jim helped me to get involved in speaking to healthcare organizations as a voice on behalf of patients and the patient experience. And I went from speaking about what needed to change to actually forging my own path in healthcare. And I came armed with my knowledge about the human systems and the technology systems that were working in healthcare. And I used that to have an impact on solving the same pressing problems that are still around in healthcare today. So, the second event, fast forward to last week. My father was diagnosed with double pneumonia, and he was the first patient enrolled in a hospital at home program. And this program is designed to allow patients who are not ready for discharge and they may need a higher level of care to recover at home and still get the level of service that they need at home. Nowadays, telehealth involves the automatic transmission of Bluetooth readings from an O2 sensor, blood pressure cuffs, and scales. Well, your daily telehealth visit with a physician happens via Zoom. And the nurses that came in and took care of my dad were helpful, they were attentive, and they were flexible as they worked out all the kinks in the program and dealt with all the technology issues that kept coming up. Well, everything came together, and my father was able to actually graduate to a lower level of care yesterday, which is like a big win. And he got to do it where he was comfortable, he had his family around, and he was just in a place that made him feel better so that he could get better. There are programs like these across the nation, and they're designed so that patients can get the care they need in a place where they feel comfortable and surrounded by their loved ones and a familiar support system. We all know how chaotic and hectic a hospital can be, and how absolutely alien you feel there, no matter who you are, no matter what your profession is. just no matter the experience, walking into a healthcare system as a patient or a caregiver is something that is absolutely emotional and can be mind blowing. Well, I'm an experienced informaticist, and what was disheartening to me was the lack of the ability of those different EMRs and the documentation systems to communicate. I'm going to give you an example, and this is a real world example. Because my father was considered inpatient, the nurses in charge of his care were home health nurses. Now, they were not able to document and they weren't familiar with the inpatient documentation system. It resulted in a lot of verbal instructions and papers being handed to my family to coordinate and to address after that clinical staff had after the clinical staff had left. And you know what? It's no easier for a sick patient or the family to track what's going on because you're in the home than when you're in the hospital, because it's nothing but a flurry of activity. It's so many conversations. It is eight things happening and trying to keep up with both of them. It's helping your elderly family members to understand what's happening. It's trying to be there for the patients. It's listening. There's just so much happening. Well, I can't tell you that the amount of duplicate documentation that I was so shocked to see was because that we have different care plans that have to be completed by different clinical providers for the services that they give, right? So that has to be filled out by the nurses, by the home health nurses. And when I say nurses, I meant the inpatient nurses, the home health nurses, the people who came to do infusions and connect up IVs, and the pharmacy had to be involved. DME had to be involved. And at the end of the day, there's still the physician charting that has to be involved and shared. All of this shared across all these different systems each and every time. You know what? There was a palpable sense of frustration for my father, who kept saying, "Didn't I just answer that?" They would say, "What's your pain?" And everybody has to ask because that's their clinical responsibility. They can't just take it from hearing it from somebody else. They have to do it themselves because the nurses and the caregivers that came were responsible and they understood what their job was and what they had to do and the workflow that surrounded it for this to be a successful program and for it to be able to show and to demonstrate that this should be used with patients at home. I commend the nurses that were here every day that had to keep saying, "Yes, I know, but now I have to do it for my part." Each one of them would have to come on and to do something different. And you know what? They did it with a smile on their face, and I'll ever be so grateful for that. I could see the frustration in the clinic team's faces because they know how tiresome it is to ask for all that information and to collect it several times. And they also know what it's like to have to put it all into the machine, knowing that you know the answers, but not able to work or to get them where they need to be in their own workflows. So, all this to say, this is a real world example. And as an industry, we have worked on connecting systems and workflows for years. There are standards based data elements and exchanges available to connect these internal systems and to connect to systems outside of our own organizations. We must use the technology available to help patients at a very stressful and chaotic time in their lives. Much of this chaos stems from a lack of standardization, ways to address privacy and security, and all of the technical challenges that come with using different systems, different equipment, and making sure everybody stays informed and everybody is meeting their requirements. The use of these standards can significantly reduce the burden on patients and their families. And my question to everybody is, why should we wait to integrate these solutions until it's legislated? We have a very fragmented, fractured healthcare system. This to me brought it up again. And this week has been very emotional for me because I realized I was experiencing some of those same old feelings of being a caregiver again, right? It was stress, anxiety, worry, confusion. I found myself having to be the master note taker again and the translator for my mom, who's a primary caregiver of my dad. I thought I had moved past that. I thought we'd come far enough in healthcare to move this forward. You know, I know my family's lucky because both my husband and I have worked in healthcare, and we've helped to design and deploy different strategies that result in healthcare programs like this across the country. We were able to come up with some of the solutions to problems that came up during this past week by arming my mom and my dad with tools that we've created in the past to help them navigate this very confusing world of patient care. What keeps me up at night is the thought of what happens to those families that don't have someone like me at home to decipher what's going on, to know when to ask a question or what questions to ask, or what to do when the clinical staff leaves and you're on your own and you have all these pieces of paper, all these instructions. What happens to them? That's why I'm here every week on my soapbox and I talk about why it's so important for us to be able to share data and use the technologies that we have available for us that work in healthcare. Because you see, at the end of the day, I'm a daughter, I'm a wife, I'm a mom who happens to work in healthcare. And when I leave my desk, my family, the people who I love and want the best care for when they're sick, they're the ones that I advocate for. And working in healthcare doesn't preclude me from all the emotions and the reactions that are part of having a sick loved one at home. So, you know what? Every day I try to live out a promise I made to myself to make this world better for others. And that's why I'm here every week spreading the word and talking about the tech that can make the programs and the experience better for the patient, better for the care team, better for the IT team, better for your business teams. That's my why. What's your why? Thank you for being here with me this week, and thank you for staying a little bit longer than usual, but it's something that we have to talk about, and we've got to keep at the forefront. And I will always be here on my soapbox talking about the importance of interoperability. I was there at the beginning, I'm here in the middle, and hopefully I'll be here at the end when we finally start to use the technology available to us to make this life better for others. Again, what's your why? Thanks for joining me. I'll see you guys next week.